the gateway to the West. Cardinal Nation. St. Louis, Missouri is the home to some of the most brilliant physicians in the world. These doctors are pushing science to its limits, healing patients in new, innovative ways, and doing it at the same time they're teaching young residents how to save lives. Meet Dr. Bruce Kramer, a SLUCare plastics and reconstructive surgeon who has introduced a whole new level of healing. You're about to meet 4 of Dr. Kramer's patients and learn their amazing stories.
Those exercises at home are making this harder.
This is the science of healing.
Can you help carry?
Want to carry stuff?
Oh, we'll leave those for later, but you can carry that.
Madison is the youngest patient I've ever treated, and she came in to the Cardinal Glennon emergency room with a very bad injury to her fingertips.
She was at home. We're just hanging out, getting ready to go to bed, and we hear screaming. So we go into the other room, and she's just bawling, obviously blood everywhere. First thing we do is, oh my God, we have to get this blood off of her and see where it's coming from. The dog was involved. Because the blood was by his cage, that she was actually bitten by a dog. By our dog, she stuck a cookie through the cage. The cookie missed, her fingers went in, so dog took her fingers, thinking it was food. Her bone was sticking out.
I went over to South Africa to do my master's research. And was studying the chimps, and that's when it happened. So I was attacked by chimpanzees. I mean, that's, you know, basically the bottom line of it. So
The 2 chimpanzees that were, they had tried to pull him into the enclosure, then they were able to sneak out, and they dragged him for quite a period of time. And so a lot of the wounds he had weren't just purely from all the bites and the attacks they did, but from him being dragged.
Well, it was a Saturday, and I was doing some woodworking, and I got out a tool, a little specialized saw called a biscuit joiner. This tool is a 2-handed tool, and I was making a test cut, so I should have had my hand on it like this and been applying it to something in a vise. But what I did not do was I was hand holding a piece of scrap wood, and I was pushing it kind of like this, and when I did, I slipped and the blade hit my hand. So I did a vertical cut through my thumb that luckily just missed the joint, and cut it, and it fell off, and it was sitting there on the workbench. It happened sub-second. It burnt like fire. It was not pain, and it was cut. And it's a very odd sensation to have that happen. Accidents go much faster than you think they will.
I basically was trapped under a truck for about 45 minutes. My leg, as I was being dragged under this truck, my leg ended up in the dualies on the, the front set of dualies on the back of the axles of the truck. And it pretty much, well, my ankle was dislocated and partially severed, and it was in pretty bad shape.
All 4 of these patients met Dr. Kramer and were amazed with the treatment he offered them. A powdered substance made from a pig's bladder that could heal their wound in a whole new way. This was definitely something that pushed the limits of science and was hard to believe.
Reconstructive surgery takes something that's injured or not normal and trying to restore it to normal. And so for me, that's the joy of the matrix stem. It takes things from injured and makes it as normal as you can make it.
But it was the hope they all needed.
The first thing that was introduced to us was surgery. And then they said, hold on, let's look for some other options. We want to send you to Dr. Kramer, and he has some things he wants to talk to you about. They said, we're not really going to get into it. We're just going to send you over there and let him explain everything to you.
It's a very common injury, be it in a car door with a dog bite or catching it in an exercise bike. There's a variety of things we see with patients.
And then he showed us the powder substance, and we're like, that is pig bladder? It was amazing just to see pig bladder in a powder substance. Something that can work. Digits regrowing is a miracle.
It is made from a layer of the pig bladder which has some of the proteins in it, as well as something called the basement membrane. And that's really the crux of the product. The basement membrane is the layer that supports skin So in that layer we have growth factors and a lot of things that really promote robust healing, along with collagens and other molecules which the body breaks down. As the body breaks that down, it then encourages healing in a totally new fashion.
We had no idea what to expect. I mean, he told us that it would crystallize and it would look kind of crusty, but eventually the skin would start to grow back and the fingernails would start to grow back because she had no fingernails at all. So we're just praying that this little girl was going to have her fingertips.
One hand high, one hand low. Push up, up, come back down, push up, one hand high, one hand low.
Okay.
I need to move these out just a little.
Somewhat coordinated.
Up.
A lot of scarring on my head. You know, I was pretty much completely bald after all of this. Lost both of my ears, my nose. So I had a big, long, grueling process to get my nose back. You know, several scars on the face. Let's see, I had a collapsed lung, and then, you know, you can see my hands here. One thing, I lost all the flesh on the top here as well as some of the tendons. So my wrist was down like that. I had another operation that Dr. Kramer actually reconnected the tendons so I could actually move my wrist again, which has really helped tremendously. I can do almost anything now that I was able to do with my hands before. At least bigger things, not so much the finer. You know, I'm not a concert pianist, but lost half of my foot and several of the tendons in my calf, which keep your foot stabilized. So the doc they went and set my foot in place, fused my ankle with titanium. So I have a bunch of metal in there. Can't move my ankle, which really, you know, kind of limits my mobility, but with the prosthetics I've been working with, really have made a huge difference. I can run a little bit now and, you know, jump a little and do a lot of stuff that I couldn't do before they were fixed my ankle. You know, I was in several boots that allowed me to get around, but I couldn't do any type of physical activity.
So those wounds all had different levels of contamination, and we approached a wound that's a bite different than we do from tissue loss from pressure or from something being dragged.
I started out in the hospital over in Nelspruit, South Africa. Was there for a while. I was in an induced coma during all that.
Andrew came to us with some devastating injuries and having been in a hospital in Johannesburg for nearly a month. So the timing wasn't ideal, but again, I think in credit they probably helped save his life. But he had a lot of wounds that had a lot of infection in them, and they really weren't healing well. Part of that was the infections, part of it was his nutrition, because he lost, I think, in the neighborhood of 30 pounds. So it was hard for him to battle through that. The company was gracious enough to have us use the product in many different areas, and so I got a lot of experience with Andrew trying it on the many wounds he had over every part of his body.
Had a few days that were pretty rough, and then we started talking to, he was kind of a chaplain there at the hospital, and he started really helping me, I guess, get back into my my normal mindset, which is, you know, forward-looking and rational thinking and trying to be practical.
On the way back, try not to put the foot down in between.
Okay.
That's the really hard one.
You know, it happened, so there's nothing I can do about that, so I can kind of move forward. And, you know, while I was in the hospital, the Olympics were going on. I saw a pretty phenomenal runner who, you know, was missing his legs. And so that really kind of inspired me, you know, hey, this isn't the end for me.
You do some triceps.
Andrews has an amazing spirit, and he could take things. So I would have talks with him about what we were going to do, and he was still very heavily drugged from all the wounds. There was not a way he could lay that he wasn't laying on multiple wounds. And every time everything we did to him caused him some pain. So the first several days we took him to the operating room every several days just to do his dressing changes. They were so painful. But gradually we progressed out of that. But Andrew was a lesson in strength and courage.
Once you get the rope going, keep your feet a little closer together.
From what I understand from Dr. Kramer is telling me, the pig's bladder, it just basically it speeds the healing process, and it even skips several steps of the healing process to get to the real good healing. So things, you know, you don't have as much of the scarring, and I mean, he could explain it way better than me. I just know that it's, from what I've been told, it's made everything so much better for me. So
it's been useful for someone like myself in plastic surgery because we get very many challenging wounds that we don't have the best answers for. And many of the operations we might envision are very huge and complex. But on somebody who's very ill, who maybe has had radiation, who has a lot of other problems, and maybe they just won't give up cigarettes and we know they won't heal well, we now have other options for them. So it's not as quick as a flap operation or where we move something from one part of the body to another, but again, we don't have the body to sacrifice that. So if I told you you had to take a muscle off of your back to save your foot, you might let me do it. But what if I told you maybe you don't have to? The game gets much more interesting then.
Awesome. Breathe, breathe, breathe. Uh-huh. Awesome.
I told my father I was going to the emergency room. He was over there. He did not even know I was injured. I picked up the piece and taped it on with a piece of electrical tape. I had gone to St. Louis University. Well, it's very close to our offices, but I knew of 2 cases that miraculous things had happened at hands there. So I went into the emergency room. They waved me through. We unwrapped my hand and started looking at it. It just didn't look good. You know, big hunk was missing. It was a mess. It was raw meat showing. You could see where the bone was. You know, I was not happy. I was in trouble. So a doctor came up, and it was my first experience understanding how SLU works. It's a teaching hospital. There's people of all different levels there. So the wound cleaning person is this person of lower skill than the stitching person, than the person prescribing drugs. And so as you go through it, what happens is there's a lot of explanations that are given to the underling staff of what is happening and why it's happening. And from a patient standpoint, this was spectacular because I felt I was participating in my treatment, and I felt I was being educated. And they all were very kind to explain to me what could happen. You know, because I didn't even know how they could sew this back on. I didn't understand how they were going to take this raw piece of meat and stop it from bleeding.
Working at a university, you get to work with people who are excellent in all the different fields they work in. And when you have a new idea and you want to try it, you can go talk to somebody and have the latest and the best. Likewise, if you're struggling with a clinical problem, you can know that your patient's going to get the best from your fellow surgeon. And nothing excites me more than helping somebody out of a problem. And it's sometimes the conversation at the lunch table, talking about some little problem, all of a sudden the lights go off in your head and you come up with a new study and a new plan and you do new things. So it's very exciting that you're in a community of scholars where you can dream the dreams that will help your patients get the best healing possible.
They irrigated the wound and they sewed the chunk back on. And they wound up putting me in a cast that to stop the bleeding. I came home, I went to the orthopods, and they took it off. And my thumb was black. The skin was coagulated blood all over. And I was unhappy. The orthopod was talking about rounding my thumb over, and I was to give me the most functionality. And I was actually quite distraught because I'm a pianist, and I was really very unhappy. I came home, I was at a particularly depressed low, and I was at my desk at work, and my phone rang, and I saw it was the university calling, and I answered, and Dr. Kramer called me.
Walter was one of the earlier patients that we took care of a fingertip with. And I noticed his name there on the chart, and I knew he had been in to see the orthopedic doctors, but since plastic surgeons sometimes specialize more in the soft tissues, and I had this opportunity, I just decided to call him.
He explained to me that he had been referred our case, and that he thought I should come and let Reconstructive Plastics take a crack and look at it. I made an appointment with him, and he saw it, and we cleaned it up. It looked much better, and I actually thought there was a chance we were going to get it to reattach. So he put some special creams on it that were like iodine based and thought it would dry out. And I left much happier that day, and I knew I'd changed what physician I was going to go to. And a few days later, my thumb actually, the part had died, and it opened up kind of like a rose opening up. I mean, it was obvious I was in trouble, and I went and saw the doctor, and he took it all the way off, and he told me it wasn't that bad. He said that there were treatments that would help it regenerate and regrow, and that I would probably be okay.
And he seemed to be a perfect candidate because he had really lost quite a bit of his thumb. So at the time when I took care of Walter, he had really lost more of that, we call it the distal phalanx, the end bone of the thumb, than anybody I had treated before. So when we look back at it, and even Walter has laughed at me and saying, geez, I wish we would have used more at that time. You know, I have learned we use a lot more of it earlier on to try to really promote the healing. But on other patients that have had major crush injuries or other things, we now approach them differently, and I think we're getting even better results with just much worse injuries to the tissues.
Give it another 20 seconds, how's that? I basically was trapped under a truck for about 45 minutes, and it pretty much, well, my ankle was dislocated and partially severed, and it was in pretty bad shape.
Mr. Smith came in as a trauma, so when I first saw him, he was an inpatient already, and his wound was it was a massive wound over his ankle. He had tendons, which are what connects the muscle to the bone so that you're able to move your ankle. The tendons were all exposed, those and necrotic and dead. He had bone that was also dead, and the joint was exposed.
All right, I'll give you one extra.
I met Mark in the hospital after he'd been in the hospital for about 2 weeks. He had a horrible foot injury with his bone, the talus, the bone that's really in the middle of the ankle, that had come out of his ankle. So it was put back in, but he had several bad bacteria infections in the wounds, and the tissues weren't very good. He had had division of one of the major arteries to his foot. He had fractured his other hip, and he's a diabetic. So the thought was, well, what can we do to try to save it?
Dr. Kramer, he was one of basically 3 surgeons that came in one day, and they kind of stated my situation, and 2 doctors said that they didn't think that they could save my foot, that they probably should amputate it. And Dr. Kramer said, well, I think I've got a new procedure, some new technology, new medicine. Well, I really don't remember how he stated it, but he said I might be able to save your foot. Dr. Boudreau and Dr. Putty. Dr. Putty happened to say, well, you know, we can take this foot off 15 days from now, but we can't put it back on. And my wife and I, we talked about it. Dr. Kramer said that he could probably between 17 and 35% chance he could save my foot. So we thought, well, you know, give him a chance.
Him having all these other injuries and lung and chest injuries too, in addition to fractures of his face, I was somewhat a little reluctant to try to take one of the big muscles off of his back and put it down there on his foot, realizing it still may not make it, as much from the infection as anything. Because when wounds have that much infection in them, they often do poorly regardless of what you do. So we trialed using this on such an open wound into a joint, which hadn't really been done before.
Just to see the results and her fingers look almost perfectly normal, he's an amazing doctor.
What are you doing?
Good.
Let's see the special hand.
Special.
Oh, you didn't even remember which one it was, did you? Oh, wow. That looks pretty good. Was this the one you heard?
No.
Was this the one you heard?
No.
No. How about this one?
Yeah.
And how about this one?
Yeah.
Okay. How do they work?
Nice.
They work good. I like how the nails don't have the scarring and how the tips of the fingers have more thickened pulp on the end of it so that there's more padding so they can really do most everything else they would want to do.
It's kind of a miracle, like something you could never think would happen, just magically happened.
There's not a lot of things in medicine we can restore normal, and with this we can pretty much get back to normal.
I am surrounded! Dogs want me!
You know, my face is pretty torn up, as well as my feet, and the fact that I can walk on them without them really giving me any issues is huge, because from what I've read and heard from people, all that scarring down there is a huge problem, and I really don't experience that at all. So
Pinch me. Yeah, good. So that's actually good. And this skin has done really well.
Mm-hmm. Yeah.
Yeah.
The results were pretty remarkable. So.
Cool. That's really done well.
Yeah, I love the flexion of it too.
Let me see you touching the tips.
Yeah, I
And
actually use this one probably more than I use this one now. So.
Cool. It's given us the ability for him to heal beyond what we could dream, and that's what's exciting. I'm doing things now with the MatriStem products that I was taught wouldn't happen or couldn't happen. So the fun thing is to dream up new ways and regimens to use things.
As these opportunities have come at me, you know, getting to be a guinea pig for this MatriStem, and getting all these doctors to try all these cool, innovative surgeries on me, it makes it all worth it. Yeah, the situation was awful, but you know, that's all behind me, and the fact that I can provide inspiration and provide a template for other people, it's, you know, it's overwhelming, it's humbling. I hope to, you know, be able to continue that and help more people get the kind of care I did here at SLU.
And it's really doing quite well.
Yeah, and this foot never gives me problems, which is nice.
That's great. Nope, that's super.
Hello, doctors. He went and got the magic powder, MatriStem, and put it on, gave me directions on how to apply it. When you put the MatriStem on, what is happening is two things. One, it is creating a matrix so your body can grow into it, a structure that can go, a lattice work, a framework of some type. And then the chemical properties of this do two things. They stop your body from scarring. And so since you're not scarring, it lets your body build regular tissue.
Then, yes, very good.
Yeah, I have full dexterity.
Sensation?
I'd say 90%. I try to explain it as a loss of resolution. It's really invoking the power of your body to heal itself. It's just sending signals telling it not to do it the way it normally would, because it normally would seal the wound off right away. It gets better over time.
Yeah.
I think it's actually going to fill in even more.
Being here at SLU, one of the wonderful things is I have a huge variety of wounds, and so in the spectrum of the wounds, I have the largest experience, at least to date, in the variety of wounds. And as such, I have given talks around the country for the company. So in terms of a disclosure, I am a paid consultant for the company. But for me, the nice thing is that my pictures and my patients speak volumes. It isn't me interpreting statistics or data. The pictures and the patients speak for themselves. So it's easy to be an advocate for something when it's something that I can't technically do. There are other approaches to them, but these approaches leave the patient the least scarred and the most normal they could possibly be. And for me, that's an exciting thing.
My thumb is good. I have a little notch. If you look at them together, you can see there is a piece missing. But the great news is that I'm probably at 90% nerve sensitivity here. It never has quit healing. I mean, it's better now than it was 6 months ago. And so I believe the nerves are infilling, and I believe in 2 or 3 years I will be close to 100%. And the thing that's amazing is my fingerprint is back, and it is my fingerprint. So the body regrew the fingerprint I had on a part that came back. I mean, it's very salamanderish when you think about it. So to think that your body knew what your fingerprint should be right there.
there is nice, soft, supple mobility of the skin.
Was just absolutely surprised about how much healed with just the Matrastem. I was off service for a few months, so I saw him in between when I came back on service, and I was surprised to see each time the wound got smaller and smaller. We were able to actually heal over bone that was initially dead that was cleaned up, tendons that were exposed, joint that was exposed, and finally we were able to close him and then actually just skin graft him. He had multiple. These were good things because one, he had a nice contour of his foot, so he can wear normal shoes, and two, we were able to get him weight bearing on that foot in 4 months, which is very quick. If you look at the studies, it's very, very fast compared to a free flap. The average is 4 to 6 months, so that was nice to see.
He showed healing that was, again, beyond what we ever dreamed, and getting his tissues back and even saving tendons that almost anybody that looks at them would think that they would be removed, and from the ankle we were able to save them. And even though he's had his ankle fused, those tendons are still there wiggling the ends of his feet.
I think that he offered me a choice that I probably wouldn't have gotten to make without knowing him and having met him. It was pretty close to where I wasn't even given an option of whether they could save my foot or not. But he made the difference basically with his knowledge of this, this procedure that he did.
Innovative, he's passionate, and he loves what he does.
We are very thankful. Who would think that science would come up with something like this?
Sometimes sometimes we're too broke to get fixed, but he sure did everything he could.
In terms of patient challenges, you have to dream it before you can do it. And what I think we specialize at SLU here is taking the good pearls and the little clinical things from science and actually trying it with patients in a very thoughtful, compassionate fashion and partnering with them.
I like knowing the science behind it because it gives me an understanding of why I'm healing the way I am, as opposed to why I wouldn't be if we didn't have the pig's bladder stem cell.
While sometimes it's experimental, we share with the patients so they can partner with us. And again, they feel the joy and participation in their healing because they understand it. So many of the patients have become experts on layers of the pig bladder, which they never, I'm sure, dreamed they would ever do.
When you look at something like this happening, you think, how could this treatment be? So is science progressed? Is this divine intervention? What really happened to cause these events to take place? I believe it to be miraculous that the treatment was there for me when I needed it.
I think in terms of the phraseology, it would be the translational science. We're taking and translating science into real patient care and giving the patients the best of all worlds.